Hello, everyone. This is Joel Martin. It's Friday, November 13th, 2020, the end of the 12th week of full in-person education at Wagner College. And we've been open since July, and we remain open now safely. We've got a lot of data to report today. We've got some negative trends nationally and regionally and in the city and on our island. And that's where we're going to start. We'll start with our ambient data because that's the most important thing to talk about as we are about to disperse and send folks out into the world. We're very mindful that the trends are not good nationally. Last week, I believe when I talked about the numbers of cases per day in the United States, did some quick math and said it takes about 8 days to get to 1 million, and now we're down to about 5 days, and the trend is really bad. There were 163,000 new cases, according to the New York Times yesterday in the United States. 4,800 in the state of New York and 1,360 in our beloved city of New York. This ambient data is most concerning. We've been tracking this, we've been sharing this and communicating it every week now throughout the entire journey of the fall semester. And we've been indicating when it's going up, and we've been seeing it go up in New Jersey especially, and now it's really gone up in New Jersey to the point where someone told me today this is considered, and I'm not trying to spread rumors or alarm, but this is considered near outbreak territory. You got to look very carefully at the zip codes, the areas, the cities. It's most concerning. New York City is still doing relatively well, and this is, I emphasize the word relative because when things are going so bad nationally and regionally, you take some comfort from that, but we shouldn't take too much comfort from this. The trend is not good. It's not good in New York. I think the mayor is talking about potentially closing schools, which had been open. I'm not talking about this college. I'm talking about public schools in New York City. And so everybody needs to really buckle down and do their part to stop this from occurring. You see this sort of now becoming a U-shaped graph. When we were planning for reopening, we were heartened by the decline in numbers that we were seeing throughout the summer, especially in our city of New York. And we sustained that for quite a long time. But now it seems to be, there's no doubt about it, we're trending in a very bad direction. And this brings us to our own campus experience, where we have some important data to share. As always, we share everything in real time, exactly what's going on campus. We've been utterly transparent about what's going on in real time to keep our community apprised. And in this case, this is the first time that we've had 2 positive tests to occur in one assay. We'd already previously reported 2 positive cases that were discerned through our rigorous state-of-the-art testing protocol. And then today we had 2 positives that we discerned. This first time, to my best of my knowledge, throughout the entire journey that we've been on for these many weeks, that we've had 2 positives in one assay. This comes from Wednesday. We've not yet seen Thursdays and Fridays, so we'll be watching those closely. This reflects the ambient environment that we're living in, and the fact that trends are not good nationally, they're not good regionally, they're not good in New Jersey, they're not good in New York, they're not good in New York City, they're not good in Staten Island, and we'll be getting to that in just a minute. But let's go through this very carefully. Also, off-campus testing is discerning positives. So we're in an environment that's deteriorating nationally and regionally, and it's very disconcerting. It's not surprising. We're monitoring this very closely, as we have constantly. On the quarantine and isolation front, we do rigorous contact tracing. Everything is up to date in that regard. If you have not been contacted, there's no need for you to be concerned at this point. We've done a really robust job. I want to thank our team that worked so hard, to get out and get the word. All the folks who've been involved. This has been our practice. We always go a little beyond what the CDC requires. We always take a little extra step, do a little additional testing, do a little more precautionary quarantining, and that's reflected in these numbers here. We have 2 folks who are isolated off campus, or two on campus, I should say. That means that they have been identified as positive, and they are electing to be isolated on campus, and they're being well tended and cared for. Our guild hall is available. We've been prepared for this, and we're taking appropriate measures to ensure everyone's safety and well-being. There are 5 folks who are isolated off campus. This includes everybody. It's not just students. It's also faculty and staff, again, reflecting the ambient increase and the exposure that's out there that's occurring. The quarantine on campus number is at 4. The quarantine off campus is 36, which is a very good option. Many of the folks involved, a few of the folks involved are commuters, or they have elected to be home where they can be well tended and be home for Thanksgiving as well. Campus beds in use for our dedicated quarantine facility, 6 out of 45. So we're well within our model, we're well within very safe guidelines. So let's move on from that. We'll keep you up to date. Always, we do report out. Every time we have a case, we report it out, and you'll be hearing from us over the weekend if we have any news to report. There will be robust contact tracing, et cetera, as needed, as we have done consistently and transparently throughout this entire process. The Staten Island, this is something we were alerting you to last week that we broke out at least the last 2 weeks, I think. We've been flagging the uptick in Staten Island and concerned about that. We've identified certain zip codes that we were concerned about. And this data here is what we have that's as current as we have, although, as you know, if the trend is going up and you're capturing a certain snapshot data point, an average or something, you're maybe lagging a little bit. So we have reason to think that the numbers could be worse in some areas of Staten Island as well. As a result of that, we are in the yellow zone. Staten Island, most all of it, if you look at it geographically, it looks on the map like 85% of Staten Island is now in what is considered the yellow zone. And in the yellow zone category of the state and city, you are allowed to be open. Schools can be open, provided you're doing some testing. We're vastly exceeding the requirement. So it's perfectly fine for us to be open and have normal operating procedures here on campus. It's absolutely within the guidelines. Yellow is the least stringent of the governor's guidelines. I think it's yellow, orange, and red. Staten Island may be on the verge of going orange. That was in the newspaper today in Staten Island Advance. And our elected officials are communicating, as they should, that everyone should be taking stringent actions, wearing the mask, washing the hands, maintaining social distance, not going crazy for Thanksgiving, et cetera. And so we're getting a good, consistent message from the governor, the mayor, the president of the borough, and our new congresswoman, who is an alum of Wagner College. The positivity rate's 3.65, and they're much higher than the citywide rate. So Staten Island is now the borough with the highest infection rate in New York City. Again, much better than other places, but being relative, it's not good, and the trend is not good. Based on this evidence, we've taken additional mitigation steps, which we communicated yesterday, and these seem to be the prudent, proactive, well-calibrated, scientifically based measures that we should take. We consulted with our higher education health analytics team. I always want to give credit to our team, especially Dr. Chris Corbo, who provided very prudent scientific advice that we took under advisement as we formulated these guidelines for the campus in this last week while we're in person on campus. Classes have shifted to fully remote instruction for the rest of the semester, except for a small number of pre-approved laboratory and performance courses. We're able to complete our academic mission intact in the next week. We're going to honor that and support that to the best of our ability. Our faculty work with our provost, Dr. Jeffrey Krause, to determine which courses need to continue, and they will be communicating that to the students so that everybody knows and everybody's on the same page. And we're looking forward to everybody completing these important activities in the coming week. Commuter students, for the sake of reducing traffic, are not permitted to come to campus because we're now moving to that remote environment for most of our courses, except when they're notified by a family member that their class has received approval to continue in person. So very much pedagogically driven by the faculty, driven by the needs of the curriculum. That would be the exception that we would support and do support as we are open. We're fully sanctioned to be open. Residential students are not permitted to travel to other residence halls. This seems like a very prudent, good step to take when you have a high ambient level out there in the environment. It is a reversal from where we were previously. We had a long period of being able to have a lot of good exchange and open communication on campus. And now, prudently, we need to dial that back. And that's just the reality. And so I appreciate everybody's cooperation and support of that. It's a good, prudent measure to take at this point when we're just so close. We're so close to finishing their in-person experience here on campus. No non-academic events of 10 or more individuals, another prudent step required by the governor. We'll talk about that in a minute. No may be held in person or on campus, whether indoors or outdoors, and all athletic practices are prudently suspended with the full support of our coaches and our athletic director, Walt Hamline. And, you know, it's been a great experience to have everybody back together. I was walking across the oval the other day and I saw a young gentleman who was a scholar athlete. And he said it's been really great to have the opportunity to work with his colleagues on the field and practice and have this chance, yet not the perfect season, not the dream season, not what anybody wanted in this country, but it's better than nothing is what the young man said, and I appreciated that. Dining on campus is restricted to 4 or fewer people together at a table, whether eating indoors or outdoors. That's not Wagner College, that's the state of New York. That's the guideline that we're going to observe because our governor has indicated that's what we need to do to be safe. So we will be doing that. Thank you. These steps, as I said, were to comply and are to comply or exceed Governor Cuomo's directives about dining and private gatherings. We want to reduce traffic to campus from surrounding areas where infection rates have risen and seem to be rising even more. We want to reduce campus density with minimum hindrance to normal operations. And we want to ensure a safe and smooth end of the semester. We've done an amazing job here at Wagner College. You know, I'm very proud of what we've done here, and we want to have a nice, safe, smooth end of the semester. Now, our actions do matter. This is a moment where I need to remind everybody in no uncertain terms that we don't have any evidence of community spread. The cases that I mentioned earlier, we don't have linkage among them, okay? They seem to be, again, reflecting, we don't know definitively, but they seem to be reflecting just the general preponderance of the ambient level of people being exposed to the virus and then getting infected. But we don't have the linkage. We don't see that yet. And that's good. We know from other campuses, however, that that students' behavior and others' behaviors can create case clusters. And last weekend, we've learned some of our students participated in that kind of behavior. So that increases the risk for everyone. And, you know, frankly, we do not appreciate that. I think I speak for most students, faculty, and staff. We don't appreciate opening up the campus in that way by failing to observe the protocols, which were clearly articulated, reinforced multiple times, and to which you signed an agreement that you would apply yourselves to fulfill like a mature person. So I will say that again. We do not appreciate that. We do not appreciate it because of the excellent behavior that we've seen from the great majority of our students consistently over many weeks in a national ordeal that makes me extremely proud and makes all of us so proud of our students. With ambient infection rates so high, our choices really matter. The overwhelming majority of our community members, and that includes people who are participating remotely, who might have wanted to be here in person, who may want to be here in person. It reflects the fact of our commuter students who have been here and our resident students who've been here. The overwhelming majority of our community members, our faculty, our staff who have been showing up in whichever format they've been showing up, they've been careful and they've been responsible throughout the semester. So let's honor that, let's respect that, let's support that. Let's not have any more breaches of protocol. I have this little thing here that just helps me think about, you know, sort of the pillars of our program and how it's been working. You know, we have an exceptional testing protocol. It's one of the best in the country. It puts us in an elite league. And we've actually enhanced that. This last week, we gained access to the antigen test, which is a quick test. It's not the greatest reliable test. It does help you when you have a symptomatic person identify whether or not they have the virus. So we've added to our arsenal. We've improved our arsenal. We've improved our protocol of testing. And so that, but you know what, testing, It's necessary. It's absolutely necessary so you can see what's going on, but it is not sufficient. You also have to be mindful of what's going on around you. You have to have a situational awareness. You have to have a knowledge of what's going on in the ambient level. And we've been providing that consistently and clearly all throughout this. And as we've done today, we've indicated that it's scientifically driven fact that the ambient level is trending in the wrong direction. And therefore that brings up the B word, which is behavior. And I don't know how many times we have said this, I'll say it again. When that ambient level changes, the behavior has to change. Because the behavior is the weak link and it can open up channels of transmission. And it's just a fact. This is physics actually when you get down to it. It's physics. There's these little particles that are floating around and they want to infect you. You can interfere with them by wearing masks, by maintaining distance, by washing your hands. You can thwart them because it's just physics. It's very simple. It's not that hard to do if you just think about it from a scientific perspective and then behave accordingly. Masks protect users. The CDC has declared this. Back in the beginning of this ordeal, they were like trying to persuade Americans to be altruistic. I wear a mask to protect you. We said that in our town hall. And you know what? That message worked because Wagner really does care and Wagner cares about each other. And I'm so proud of how we have shown up with that guidance and been so good to each other consistently for so long. Now the CDC has added another argument to this, and this appeals to those of you who are just selfish, not that any of you are, but those people who are just selfish, who have to be cared only about themselves. Okay, fine, masks protect you too. You wear the mask, it protects you too. It blocks the particles, So now we can do the altruistic argument, which works for Wagner, okay, in a great way. And now we can do the selfish argument for works for whomever doesn't care about other people. So I hope that everybody can take that out into the world and take the Wagner spirit of being altruistic and try that approach with people who are resistant to taking a simple step to protect others. And if that doesn't work, try the selfish argument because we now have that in our arsenal thanks to the CDC. Again, I can't tell you how proud I am of Wagner. It's been an unbelievable journey. It continues. We've got to finish strong. We've got to finish safe. We've got to be well. We are so proud of you. And I don't want to lose that. I am so thankful that I have the opportunity to work with you, with the team that I have, all the people here, the faculty, the staff, and the students. We cannot be more proud of you. Let's just power through one more week and then finish well, working with your faculty, your coaches, your mentors, your friends. Let's finish really strong and let's be thankful to each other that we've had this chance to work together to make this happen. In spite of the challenges, in spite of the problems, we've done a remarkable job and I want us to finish strong. And I want you to be well, be careful this weekend, and let's have a great week and I'll see you next week. Take care.